Good luck.
Welcome, everyone. We're going to wait a little bit for everyone to join, but we will get started in just a moment.
Okay, I think we're good to go, right? Amanda? Can you hear me?
Yes, we can hear you and we're good to go. So let me know.
Okay. Thank you. Thank you, Amanda, and everyone for being here this day. Greetings to you all. Good morning, good afternoon, good evening from wherever you're tuning in from. In Uganda, it's late night, literally 9 p.m. But yeah, it's a beautiful weather. I hope you're all excited for this particular session. And I wouldn't want us to waste so much time. Like you can see from our topic today, we're going to have our youth perspectives being brought forth, and we're going to speak about investing in menstrual health as a human right. We all know how much has been left out, especially in advocacy in menstrual health. And so the panel discussion today is going to delve so much into that. And just for you to note is that today we're going to have a conversation ranging from the cost of inaction, why it's important to invest in menstrual health, but then also delve into the different regional perspectives of how menstrual hygiene and health has been perceived, so that we have a whole global reach of this conversation. And then in the end, we should be able to have take homes, at least what action plans do we have, what are we doing next, in our countries. So we hope you can have fun in this conversation, but also please do note that I will tell you how exactly we're going to delve into it, and also encourage you to keep your questions and your comments as we get along. So without further ado, I just want to welcome Rachel to give us opening remarks. For those that are joining in and are not part of the Global Youth Fellowship, you're going to get to know more about it. And so Rachel will give us a little bit of the background of why we are here today, and also a snippet of what is yet to come, in the other sessions. I know we have a whole lineup of different activities ahead of CSW69. Rachel, if you can hear me, over to you.
Yes, thank you so much, Patience, and welcome everybody. We're really excited for this first event of our Youth Preparation Series, which is a series being put on by our Global Youth Fellows, who are remarkable young people from all over the world. We've chosen them out of over 2,000 applicants, 15 fellows, and they're each really incredible. And they're going to be putting together these series for you. And if you go to our Instagram page, you'll be able to see the rest of the lineup. It's a really, really great lineup, and so we're very excited.
Thank you, Rachel. Well, ladies and gentlemen, and everyone else in this space, we respect you in your all capacity. Allow me to introduce to you this amazing panel of three great activists from the various countries. I want to start with Laura. I just wrote something brief here about Laura. And so just to my panelists, if you get any technical issues, please feel free to inbox me so that we're able to have a smooth running of the panel, or reach out to Amanda And I will just give a very brief introduction of you all and give you a chance to speak and say hello to the audience. I'll start with Laura. Laura is from Costa Rica. She's a Global Youth Fellow and part of Group 1 that is chairing today's session. Laura is the General Manager and co-founder of Cyclica. I hope I've pronounced it properly. You'll correct me. And she graduated in International Business and Commerce and Contemporary Dance from Costa Rica. Laura's work is mainly dedicated to innovation in products for women's intimate health as a key to female empowerment. Amazing, amazing work, Laura, over there. Laura, would you like to unmute at this point before I move on to Aseel and Ashlee? Just in case I left out anything, but if I didn't, you can just unmute and say hello to the audience and we'll be able to move forward.
Yes, thank you very much, Patience, for your introduction about myself. And yeah, in Cyclica, we have been working since 2018 to facilitate access to intimate health products that are friendly to the environment, health, and comfort for women, expanding the channels that offer these products throughout Central America, while providing easy to consume information on intimate sexual and reproductive health issues to also help women to make informed decisions about their lives. And I'm really, really honored to be here in this panel, and I'm really excited to see all the perspective of the other colleagues that we have here in this session.
Thank you so much, Laura, for giving us more of what you're doing. I know at a later time you're going to delve into that. Ladies and gentlemen on the space and everyone, I want to introduce Ibrahim. Ibrahim is also a Global Youth Fellow and part of Group 1. She's from Jordan. Ibrahim is activist with a focus on advocating for AIDS. She currently is pursuing. She's also part of the She Leads project supported by Plan International. So Aseel, if you can unmute and tell us anything else that I probably left out, and also more about She Leads, just briefly. Over to you.
Thank you, Patience. I'm not sure if the voice cut from my side or from everyone, so we were not able to hear much about me, but it's okay. So my name is Aseel, and I am part of She Leads program, which is led by Plan International and many other partners. So She Leads is a 5 years project, and it is divided into different youth groups in 7 countries. And in our region, in the SWANA region, we are mainly working with Egypt, Lebanon, a little bit in Syria, Palestine, and in Jordan. I am part of the national and the regional advisory boards, and in our national board, we have started an initiative called Right Not Luxury, which specifically is targeting the youth to raise awareness on period poverty in the MENA region, which you may or may not know, is significantly affected, especially because of the humanitarian crisis and the genocide and wars happening in the region. And a lot of, let's say, cries for help has come out from young women and girls about the lack of inclusion of their menstrual and hygiene products in the aid, which basically made us more determined to bring this issue up to the front. We work alongside, like also other groups and many other let's say youth-focused issues, but mainly this is the one I'm representing in the Global Youth Fellow. Thank you.
Thank you so much, Ibrahim, for giving us a snippet of what you do. Really amazing work. And our third panelist today is Ashlee. Ashlee is a queer Caribbean educator. organizer and researcher, serving as IPPF's global lead on comprehensive sexuality education. For those that do not know, about IPPF. I'm sure Ashlee is going to tell us about it. It's International Planned Parenthood Federation in full. So you can search about it and also read more about what they do just shortly from her conversation. And just briefly more about Ashlee is that she holds a master's in Science Education Policy and International Development from the University of Bristol and has been awarded the Colin Robinson Hardhead Award, for transformational activism in Trinidad and Tobago. I love how amazing this panel is. So Ashlee, just briefly, and then we can delve into our conversation. Anything that I probably left out or something very little about IPPF?
Yeah, sure thing. Thank you so much, everyone, for having me. So I'll give just a short background on IPPF. So we're a global sexual and reproductive health provider, working in over 140 countries with 150 member associations and collaborative partners. So we do work on CSC, safe abortion services, contraceptives, maternal care, doing work in humanitarian settings as well. So you'll hear a little bit about that as it pertains to mental health education and what our members are doing.
Thank you so much, Ashlee. So we're going to have this conversation in two parts. One, we'll have a few questions to our panelists, and then the audience will be able to engage with us, and then we can come to a conclusion. And my first panelist to get to respond to a question here will be Laura. So Laura, as you prepare, I just want to briefly inform the audience that our conversation today has been informed by the fact that menstrual hygiene or period poverty has been a big challenge, not only in the low developing countries, but globally. And this kind of poverty in menstrual hygiene and health is not just because of the limited access to these products, but because of so much that surrounds this. Period poverty usually affects people in their access to education, employment even, and also the kind of self-confidence that they have because of the stigma that surrounds it. And as you're going to listen to the panel discussion, we want to basically build on those stereotypes that are there within our regions, but then in the end, find out what exactly the challenge is, what is not working, and what can work best, especially as we head into Beijing 30 celebrations this year. What reflections do we have? So I'm just seeing a comment from Amanda. Yes, please, you can do that, Amanda. That's okay. So for our conversation today, I just want to shoot to Laura. Laura, why do you think menstrual hygiene should be a human right? Why should it be a matter of urgency, of concern? And as you respond to that, briefly tell us a regional perspective from Central America. What is it like on ground, What's the poverty rate there in menstrual hygiene? Yeah.
Sure. Thank you very much, Patience. Well, menstrual health and hygiene management, it's closely related to the people's possibility or ability to exercise their rights. For me, that's the whole point. That's precisely what it's so essential for to invest in this area, because although menstrual health and hygiene is not shown also as a sustainable development goal, even though it does have implications for like 6 of them: the health and well-being, the quality education, the gender equality, the clean water, also the decent work and economic growth, and the responsible consumption. So yeah, we can see how the menstrual health and the hygiene management represents a lot of areas in our lives that give us the possibility to develop in society as a human beings, as we should. And that's for me the whole answer after all. And speaking about a little bit more of Central American situation, for example, in Guatemala, only the 55% of households have a toilet at home, for example, which makes difficult to properly manage our needs in every way, but especially when it comes to menstruation. Also, in all the region of Central America, 1 in 10 girls misses school due to the lack of sanitary pads, or even though to have the infrastructure in their schools so they can manage their intimate health. In El Salvador, it is estimated that 1 in 10 girls drops out of school due to this menstrual poverty, which can translate into the loss of 360 days of school in 6 years. So, as you see, and if we can go a little deeper through this panel, we are going to see that we are not develop ourselves in the same way as our partners demand, right? And also, the 95% of adolescents here in the region feel uncomfortable attending to school during their period, influenced by all of the stigma and all of the taboos surrounding menstruation. So yeah, that's a little bit of uh, the statistic and how everything it's like a cycle, because of this we are not achieving this, and it's causing all of these other implications.
Wow. Thank you so much, Laura, for shedding more light on that. Indeed, it's really quite sad because I know the statistics you've mentioned are actually not very far from what is happening in Africa. Because in Africa, I think 1 in 5 girls miss over 5 days of school, every month. So that counts to almost 1 month and a half. In a school term or something, which is quite absurd. So it's really very touching. And so to Aseel, I want to get to you now, really, from what Laura has mentioned, the statistics that are happening in Central America. I would like to know also the statistics in Jordan and the regional perspective from your end. What exactly is happening on ground in as far as period poverty? Because when we understand what's happening on ground, then we're able to know or now identify the different challenges that are there. And as you give us that snippet of the statistics or what is happening on ground, I just want you to also share what challenges you have seen, beyond what's happening on ground. What exactly is the biggest challenge there? Yeah.
Thank you, Patience, for the question. So I want to start basically by saying that 5 million girls worldwide are affected by period poverty. 1,000,007 of them are Arab women and girls. And in Global Youth Fellows, I'm one of the people who are representing SWANA. And to be very honest, and it's no secret, our region has been affected by conflict and wars and the humanitarian crisis for a long, long time. And since, let's say, COVID-19, the inflation has made the life even more difficult for women. I can say that also, as this region is the region that is the most water scarce in the world. So I just want you to imagine this picture of a girl who's experiencing her first period with no, let's say, during a genocide, maybe her mother and every let's say a person who experiences menstruation in her family is dead. There is no access to products, as there is no humanitarian aid that is getting in. I want you to imagine also the cold and the hot weather, because we are affected. Our region is affected twice as more with the global warming. So we either have very cold nights or we have very hot summers. So in either ways, these changes in the climate are also affecting the bodies of the young women and girls. So however you look at it, it is a challenge in the region. This is not just this is just to mention the situation, let's say, in Gaza. We have also the situation in Lebanon and Syria, where they are affected. The menstrual products, while the inflation in the price is absolutely insane. It's 500% in the price. So what used to cost like $4 now costs $40. The prices are insane. The people, especially in our region, we have also very low income in our region, and also we also have a high, let's say, social stigma around this. A lot of mothers and daughters don't even talk about this. We don't have any sexual education in schools. So basically, young women and girls are left to this challenge of exploring this, phenomena that happens to their body every month alone, with no help. So basically, this is the picture in our region: the inflation, the lack of water, the lack of hygiene products, and the climate change, in addition to the conflicts and wars, are all affecting how women in our region are experiencing their periods. And to your second question, uh, if you can repeat it again.
So the second question is slightly close to what you've already responded on the unique challenges that are faced in Jordan, especially in regards to period poverty.
Yes. So uniquely to I would say it's to the Arab region in general, is that the educational costs, because as I said, we don't have any comprehensive sexual education. Talking about it is, like we only like, and this is like a story from our initiative. One of the girls wanted to make an information session online on one of the huge recognized public platforms for volunteering. And one of the issues that they said to her: you cannot really call this period, you can't really call it a session about period poverty. How about you just call it a session about healthy lifestyle? And you can just see how socially it is looked at. Also, the information is not available online, it's not available in Arabic. There is a huge lack of information on that. And also, as I said, the economic cost, because the inflation in the Arab world is one of the highest rates in the world. This is basically something that is uniquely maybe to our region. And I would say something maybe that applies to all region, but there's also like a lack of public and decision makers will to engage with period poverty or with topics about women and young girls' health in general.
Interesting. Thank you so much, Aseel, for sharing that. And when you were speaking, I just thought of how actually unique different countries are. In as much as we have that one uniting factor, of period poverty, you speak of the Arab countries, and then the war, the humanitarian part of it all, adds more to the cost of period poverty that we face. Quite challenging there. And when you spoke about also the inflation rates, it just took me to 2020. In 2020, when it was mentioned, I think was it I wrote it down somewhere. Yes, Scotland became the first country to provide free sanitary pads, products in schools and to really the citizens. Could that be a way forward? We don't know. How sustainable is that, in even low developing countries? That could be a question for us to think about. And I just want to quickly get to Ashlee and then come back for one round of questions and get to the audience. So that we are able to have a conversation here. So Ashlee, as with IPPF, you're doing a lot of amazing work, and with your current position as a global lead on comprehensive sexuality education, what do you think is the key role that sexuality education can play in as far as increasing the impact of menstrual hygiene, and also taking us into the gist of today's conversation: investment in menstrual hygiene? How best can we invest? Is the investment only monetary, or is it as well educational in nature? Over to you, Ashlee.
I think I need just a repeat of the question, because I think there are many
The
parts.
second bit. So the first bit is your work with IPPF and your current position. Do you think sexuality education is the way to go to improving our investment in menstrual hygiene? Yeah, I'll repeat the second one after I've responded to this.
Okay. So
Yeah.
I know, so I mean, around the world, there's a lot of pushback on CSC as we know it. There's a lot of misconception as well as to what CSC actually refers to. So once people actually hear the term comprehensive, they think there's no end. It's everything we're going to be teaching young people. But when we really break down CSC, there is international guidances that speak to what CSC is meant to do and the modules and the content of CSC programming. And so what CSC really does is to help young people to understand how they can learn about their bodies, but also navigate the world around them. And a critical part of CSC also includes menstrual health education. And we know that when young people have access to menstrual health education, it's it's a domino effect. Yes, you learn about how to manage your period, but also you learn about how your body goes through puberty. You're able to learn how your body feels and what you need during the time of your period, and also helps you to make informed decisions about how to avoid unwanted pregnancies, when you need to go to the doctor, when you need menstrual health care. And oftentimes these aren't things that young people are being able to access. And the reason why is because oftentimes when we think about menstruation, it links to sex. So anything that looks at sex, it's a huge taboo. And it's also something in my region where folks believe that once young people are learning about how to avoid pregnancies and learning about their period, that it automatically means that they are going to engage in sexual practices. And so it's really important that we do invest in CSC at different levels, of course, taking into consideration the various contexts that we live in, and then ensure that we do adapt it to suit. Because what might be delivered in a European country can't be delivered, for example, in Trinidad and Tobago, because it's different contexts. So it's important that we do invest in that so young people are able to access the education that they need, but not just the education, right? When we think about menstrual equity, which is another thing as well at IPPF, we also look at the provision of free menstrual products, access to the healthcare services, and also that support for mental health, because they are all linked. A lot of people experience PMS, so premenstrual syndrome, but there's also another type of it, which is PMDD, premenstrual dysphoric disorder, and that's like PMS on steroids. And a lot of young people are experiencing this. They have no idea what they're experiencing. They're just thinking, oh my God, I'm very depressed around my time of the period. But because they're not educated in school, they have no idea what's going on with them. There are also a lot of young people that I've also encountered in my local work who would have gotten to the age of 19, had extremely ridiculously painful periods, had no idea why. And then they went to the doctor and realized they had a very late stage of endometriosis. And so it's important and critical that we do invest in CSE so that we can avoid these issues and ensure that young people can live quality lives.
Impressive, really. Thank you for sharing that, Ashlee. And in the chat, someone even mentioned that, in fact, if we can't have such conversations, then how are we supposed to address them, you know? So indeed, sexuality education is quite a huge toll right there. And my second half of the question will also cut into Laura and Aseel at a later time. You can take note of it. But then what social costs have you seen in your region as regards to menstrual hygiene? What costs have been noted down or highlighted, or have you experienced, or even just observed around? Yeah.
Yeah, I mean, in the Caribbean, we have a culture of silence, which I think is quite similar to other regions. So a lot of times there are young people and older folks, so in schools, in the workplace, who are forced to miss classes because they're on their period. Now, we don't have sufficient data. There has only been 2 national studies in Trinidad and Tobago. Both were surveys, and they were only reaching 500 people. But we know with surveys, it means that people who don't have internet access cannot be a part of the survey, which often intersects with those who may not be able to afford the menstrual products. And so we have that, loss of economic gain because they can't go to work, loss of classes, which also affects their performance in schools. But we are a very religious region. I think it's quite diverse, where there's Christianity, Hinduism, Islam, like there's a lot of different religions. And each religion, based on the practices of people in the Caribbean, has its own caveats, right? I remember being in church once because my dad was a deacon in the church, and I went to a service with him. And the sermon at that time was speaking about unclean women during that time of the month. And in different religious practices, that's also a tenet, right? And so there's also that impact where we grow up believing that we are unclean, which means that we aren't able to engage socially as the way that we should, because we think we're unclean and we should not be engaging with other people. There are also some households that will build like kind of outhouses for the young women to go in during their period. So they aren't engaging with the family. They can't cook. They can't participate in their religious ceremonies. And so it's a lot of isolation that happens, which leads to impact on their mental health. So all of these things do overlap because we aren't getting the adequate responses from the state, which means that the cultural barriers are being pervasive, and it isn't something that I think may be able to change in our lifetimes because it's so deeply ingrained and we have that culture of silence.
Yeah, I hear you really on the culture of silence. I think it's really cross-cutting and global. I wonder how best we can break it. But of course, just like you've mentioned, sexuality education is one of the key things really. And Laura, as you prepare, because my next question to you will be around any successful initiatives really towards evading period poverty, because I know I've spoken a lot about the challenges that are in place in our regions, and we realize all these are interconnected. It affects our education, our employment. For those that have been dropping off or have just joined us, we are having a conversation on investing in menstrual health as a human right. And when you were speaking, Ashlee, but also Laura and Aseel, I thought about a few examples of the African perspective. Now, I'll give you a very quite sudden example from Uganda. In Uganda, I think it has drastically dropped, but people used to dig holes in the ground just to sit on them the entire day so that they could bleed out into the sand. Now, they would do this because they can't afford sanitary pads. They can't afford all those menstrual products that we keep mentioning. Some of them do not even know about that. They only know it's, sanitary pads that are supposed to be used. They do not know about tampons, they don't know about menstrual cups and all these other options, or even the reusable ones before they came into place. The other thing that just happened, I think less than 3 months ago in Uganda, a particular school in a region, Busoga region in Uganda, school-going girls were using sand in order to go to school. They would put sand in their panties in order to menstruate, and then they're able to attend school, because if they do not do that, then they would actually miss over 5 days of school. But that's not even enough. There are people who use reusable pads and use them without properly washing them. So you can see that chain of health in general, just like our panelists have spoken about, that indeed, as we're speaking about menstrual hygiene, we should be thinking about health in general, because when one's health is off, then trust me, all the energy is split across. So I just don't want to really delve so much in those very saddening examples, but we all really agree that the cost of menstrual hygiene is quite high, and we have a lot to pay for it. So Laura, having spoken about all this, are there any positive initiatives that we could take a leaf from, probably any best practices you've seen in Jordan or any other regions really, because that then would give us some hope for the conversation today, that we have a way forward. Yes.
My turn, right?
Yes.
Well, yeah, that's a really, really sad things that you are telling us, Patience. And I'm just going to add, but about what you are saying, that the failure to invest in menstrual health means that it increased long-term public health and social assistance costs. That's why it's so necessary for the governments to invest in this kind of stuff. And yeah, there are some initiatives here in Central America that they have been working towards to just to put like a seed over this whole dilemma that it's really, really big. For example, well, it's really it's an honor for me to say about this initiative that is from Nosotras Women Connecting, which Amanda is part of it, and she was leading part of these efforts. And Nosotras Women Connecting, they promoted to approve the law about menstruation and justice in October of 2023, I think, and they collaborated with the Embassy of Costa Rica to the United Nations in Geneva, also to address menstrual poverty in a global way. Also, they have the initiative called Cambiemos la Regla, which means let's change the rule, which is a campaign to collect menstrual products to seek to provide these supplies to girls and adolescents in vulnerable conditions. And also very honored to say that Cyclica was part of this initiative too. Also, I believe that Essity, which is the company of this pads called Sava, the brand, they have been doing menstruation programs to students and with the strategic alliances, I think, reaching both schools, students, and vulnerable communities. And I believe that the brand always have like this campaign called Girl Helps Girl, which is in Costa Rica, Guatemala, and El Salvador, that seeks to raise awareness into this issue of the menstrual poverty. And the brand donates a sanitary pad through an governmental organization. However, this is like a few initiatives that I know here in the region. However, I am not aware of any initiative oriented orientated toward the use of reusable products, which is something that from Cyclica we really reach forward, because we know all the benefits that these kind of products can do over the economics and also for the health of the women. So only in our organizations where we have worked with the United Nations High Commissioner of Refugees here in Costa Rica, where we distribute menstrual cups and also reusable pads to these populations. That's another thing. But yeah, I know, and as I believe that the reusable products are really, really important. However, I know that the beginning it's with the non-reusable ones, because right now what we need, the problem that we have is that there's no access at all. So after that, we can go and reach for the reusable ones, and then all the benefits and education that comes behind all of these products.
Thank you so much, Laura, for sharing that. I think we can all see that actually a lot is still being done, and we all can merge efforts, to try and push for menstrual hygiene. And of course, reusable pads are quite they are sustainable in rural areas or places where menstrual products are quite expensive. But then I think as we also give them out, we need to share information about how to use them, how to keep them clean, and whatnot. So, Aseel, I just want to also get to you. Are there any youth, initiatives within your region that you think are actually working, in as much as we have spoken a lot about the challenges that are being faced? What do you think can work better, that maybe we need to invest more time and energy into?
Yes, thank you. So, as far as I know, most of the, let's say, organizations that engage with providing solutions for period poverty, most of them, the local ones, are collaborating with also international ones. So we have Interutopia, Wing Women, Loving Humanities. They all have amazing, amazing work on raising awareness and also producing reusable pads to be used by people who menstruate. The other thing is, and I find this very very inspiring because in Jordan, for example, we have Syrian refugee camps, and in the Syrian refugee camps, they usually take like an allowance that is like um, around $2.70 for buying products for 3 months, which is not even enough to buy a product for 1 week, by the way. And despite that, and they also give it to a specific ages, so it's between the ages of 14 to 45, not taking into consideration that in our region, girls begin to have their periods when they are 8 years old, and it continues until they are 50. So despite this very sad reality that happens in the refugee camps, we still see them in the front of creating very creative solutions and sustainable solutions to deal with their period poverty. In addition to that, and I feel like our initiative, Right Not Luxury, is also leading an amazing work on starting the conversation around period poverty. We have done some roundtable discussions with some decision makers. We are also reaching out to our parliament members with more information about our let's say initiative. Most of our work has been on conducting awareness sessions about what it means and how it also intersects with mental health and in general the health of every young girl and woman. But at the same time, we're trying to also expand to also start helping with providing material aid for women who need that. So yeah, I believe that's the work that is being done in my region. It's usually as always, the individuals are donating and helping each others because unfortunately the decision makers and the people who make the policies do not consider young girls and women and their needs and their health in their decisions. So it's usually individual donations and local organizations who are always looking for the funding, international funding, in order to implement their projects in the region.
Wow, thank you so much for sharing that as a really impressive work, right, not a living. Guys, I hope we are checking the chat room. Rachel is doing a very good job sharing the links. Let's please check the amazing work that is being done by these panelists. And also shout out to those who are not Global Youth Fellows but are joining us. Please read more about the Global Youth Fellows and follow NGO CSW New York, but also follow our panelists and the amazing work they're doing. For example, Ashlee with IPPF, Aseel with She Leads, but also Right Not a Luxury, and then Laura with Sikla. And yes, so much of amazing work that is being done. Well, we've had really an amazing discussion, and I just want to delve into our audience. If you have any questions or comments, I see a number of comments already in the chat. I will read them in a very short time. However, feel free to put your hand up. I'm seeing Sayo. I'll get to you very shortly, and then we'll take, I think, about 4 hands because of time. So that we can have a good day wherever we are, or a good evening wherever we are. And just before we get into the panel discussion, I just want to briefly share about the work that I do in West Nile region of Uganda, which is under a volunteer-based organization called Femme Talk West Nile, femme in the French word for lady or female. And the volunteer organization basically pushes for youth advocacy and leadership, but we major on menstrual health advocacy. And through that, we opened up a pad booth. We called it a pad booth, but it's the only pad booth within the region. So we provide free sanitary towels to the ladies in the community, and we tell them, you know what, do not stain. If you get into an emergency, please drop by our offices and pick either disposable pad or reusable pad. So every year we receive at least over 2,000 sanitary towels from our partners, and we try to give them out really at no cost. That's, I think, one of the challenges, as you have heard from our panel discussion. So I wouldn't want to preempt what the audience is going to state. Over to you, Sayo. You can give your comment or question. And to those that are giving their comments in the chat room, please make sure you can tag or mention the name of the person who you're directing the question to. But if it's overall, then I'll probably dictate to my panelists. Yes, Sayo, you have a minute to give us your comment.
Thank you. Thank you so much, Poni. I am excited to be here. My name is Sayo. I'm from Kenya. I will be attending the CSW through Women Deliver, and I'm part of the Emerging Leaders Program. My question goes to Ashlee under IPPF, and also what I don't want to assume your pronouns, what Ashlee had mentioned on menstrual equity. And I wanted to relate it to in law, we talk about equality is equity. And I wanted to relate it to gender diverse persons, especially intersex persons who go through who go through menstruation basically, and experience their menses in different formats and forms. And their experiences are valid, but they don't have even these menstrual products that we're talking about. Not many of them are inclusive enough to like fit them or like be comfortable enough for them, or even the health specialists or the research that has been done is not enough even for the professionals to actually handle such cases. So how do we deal with this? And under IPPF's objective on menstrual equity, and also being inclusive of all lived feminine experiences beyond just the gender binary. Thank you.
Thank you so much, Sayo. I hope the panelists are taking note of the questions. I want us to go through all the participants that would like to ask a question or make a comment, and then we get to the responses at once. So I see Resti. I know Resti, she's from Uganda. Over to you, Resti.
Yes, can you hear me? All right, thank you, Poni, and I'm happy to join this discussion. Just briefly, recently, I and other team of colleagues, we just conducted a research in Kenya. It is on menstruation still. Mine is not actually a question, it's just a comment on some of the things that we found out through our study is that actually in some, because we are conducting this study in deeply rooted rural areas, but we also got to understand that some of these families cannot support these girls, not because they cannot manage, not because they don't have finances, but it's because of the stereotypes that are attached to menstruation, whereby you expected, because as soon as you maybe you're going to your first menstruation, so definitely you're mature enough, and so your parents expect you actually to find a man for yourself. And also it is not a priority. It's not something like you can maybe wake up and put on the list, like this is a priority. My daughter has gone through menstruation, so I need to, it's not like a priority, but they do have really the capacity to afford these pads. My point is, so you realize there's an knowledge gap in all this. So it also goes back to how can we really inform the guardians, the parents, the communities, to start, like someone was saying, menstruation is something like it's always sidelined. You don't have to mention menstrual poverty, but why do you have to hide for menstrual poverty? It's high time we start having those direct conversations. It's high time we start like engaging them. They need to know menstruation. They put it on a priority list. If someone's going for shopping, because these rural families, they are growing tea, they are growing coffee and all that, and they can afford a pad a month for a girl. But because it's not a priority, it's because they have that what should I say, the rigid mindset and all that, so they cannot do what they just don't give it a priority. So it's just an knowledge gap which we need to address. But then also, as we advocate for government to provide free menstrual pads, realize that it is not sustainable. How can we go on with sustainable initiatives that can support these girls? Back then in Uganda, I have an organization here for foundation, and one of the things we have tried to do is we are trying to teach these girls like how to make their own pads, because also I realize you may not go back to the same villages to distribute pads over and over again, but if you teach someone how to fish, most probably they can also be able to do something for themselves. Thank you.
Thank you so much, Resty, for your comment. I just want to get into some of the comments in the chat room before I get to you, Patricia, and then back to the panelists to respond. So we have a comment from Hawa, yes, saying that yes, most often people don't want to talk about periods. If the problem is not discussed, how do you address the challenge? We need to change this. And of course, she says, great conversation, team. So shout out to you, the panelists. And then we have a comment from Jovia Kusima. I am very biased. I also know a number of Ugandans in the space. So Jovia is also from Uganda, and she says, insightful, 100%. Sexuality is still denied because the opinions of teachers, parents, and some political leaders are alarming. And we have a few comments of heartbreaks there because of the examples that we gave. And then we also have a few links shared there, but Hawa again says because of lack of information reaching the girl child on menstruation, menstruation will be missed in schools, and once the boys see that, they will begin to bully them. I think she's speaking about stigma. We also have Ashlee responding in the chat, which is amazing. And the second last comment in my chat here is Ajing. I hope I'm getting the name properly. Ajincha or Ajinkia. Education is important for preventing infections and other health issues and for reducing the shame and fear that can prevent girls from participating in schools. And we have a question from Teresa. I think I will direct this question to all the panelists. Please try to respond to it. How safe and healthy are reusable pads? I see Laura has already commented, but if you want to also add on that, would be appreciative of that. How effective are these reusable pads? And also, just to the end here, I see a shout out from a colleague and friend, Ronald Twikirize. Thank you for saying hello to me. And very lastly here, Jovia Steele Kusima says, I have done outreaches and research. How can we teach these women and girls that they can be comfortable as they use the reusable pads? So I think the biggest question that we have had from the chat is really around the reusable pads. So Patricia, quickly to you, and then I'll start with Laura, Aseel, and end with Ashlee on responding to the questions. Yes, Patricia.
Thank you so much. Thank you so much, Poni, and thank you so much to all the great women that we have had today, and all those that have given in their submissions. I'm Patricia Isekwa from Uganda. I'm an education specialist. I think I must really appreciate whoever's come up to advocate for menstrual hygiene within the schools and even the community. Thank you so much. And one thing that I want to inform us is we should not shy away about menstrual hygiene or menstruation, because this is what every woman must go through. One thing that we have to do is to ensure that we speak loudly about it. We speak so proudly about it. And to any normal lady, to any normal woman, they're supposed to go through it. And in regard to the bullying by the boys, by the men outside there, one thing that we have to inform them is that their sisters, their mothers, their wives, they all go through this. So they have to work hand in hand with us to appreciate the fact that every woman is supposed to go through this. And we have to ensure that we bring them in to campaign for a safe space for menstrual hygiene within the schools and community. That is one. And I also want to encourage whoever is advocating for menstrual hygiene within the schools, trainings, kindly and please let us involve the boys, because they must be the champions for a very safe space for our girls within the school. When we leave these boys aside, when we are training the girls, that is when stigma and bullying is going to come in. But once we involve them to appreciate that this is for every woman. And we also involve them when we are training these young girls in making reusable pads. Then they will appreciate the fact that, okay, we are part of this. Our sisters go through this. I think what we have to do is to support these young girls to ensure that we create a very conducive environment for them whenever they are going through their menstrual spaces. And when we come to the community,
As you
let us
summarize,
sensitize.
we're running out of time. Sorry.
Thank you.
Yes. Did you complete? I can give you 30 seconds to conclude.
Thank you. And when we come to the community colleagues, one thing that I want to tell us is that our community members listen. Let us involve them. Let us involve them from the family to the local leaders within the community. Let us involve them. They listen, and we can work hand in hand with them to create a very big change for our girls within the community. Thank you so much.
Thank you so much, Patricia. Unfortunately, Achema Ben, you're going to have to type in the chat room because of time. And thank you once again to all that are here with us for this particular session. Our time is fast spent, but I've been given about 10 minutes to wrap up. So I'm going to get to my panelists, Ashlee, Laura, and Aseel. So as you respond to the questions, I want you to as well give us your parting shot, so that we wrap it all at once. You can quickly respond to the question or make a comment and then give us your parting shot. And in the parting shot, I want you to specifically tell us what next. What's the way forward, because we have had this amazing conversation about investing in menstrual health, but then what next? So Ashlee, I'm going to start with you, Ashlee. And as you come, Ashlee, I just want to give a shout out to our alumni of the Global Youth Fellows for Gender Equality. I saw one particular one, Tendo Rachel, who was in the cohort 1 from Uganda. So I'm happy to see her as well on the session. I see Hawa, I see Prince, our current fellows. So we really appreciate you for making it here. And without further ado, over to you, Ashlee, your response, and then your parting shot with what next, what can we do, what action plan do we have? Thank you.
I just have just 1 minute because I have to hop off for another meeting. But just to respond to the question quickly, so IPPF is a human rights organization, which means that we work with all people regardless of their social determinants. And one of the things that we really do support our member associations and collaborative partners is to seek constant training. So right now in the region of the Americas and the Caribbean, there are healthcare providers that are doing trans healthcare training to be able to understand the needs of the diverse populations we work with. And also in our CSC programs, of course, it varies from context to context, but in out of school programming, it's a little bit more flexible to address gender and power and how that also impacts menstruation for young people. And then my parting words is we really need to invest in menstrual health education, and not just for typically women and girls, but for everyone, because we need champions across the board to end the period poverty. It's not just about access to products, but also access to education. So thank you.
Amazing. Thank you so much, Ashlee, and have a good time. Thank you. So over to you, Laura. Any response to the questions, and then your parting shot as well.
Sure. Thank you, Patience. Well, I think I have like a more general comment overall, because there's a lot of things going on the chat also, and the questions that they did. And I think that the essential part of this is education, to achieve real cultural transformation, especially in the regions where religion is deeply rooted. And this prevents people, also both women and men, from feeling confident in speaking and asking about these issues in general. And so we can normalize it. This is how we promote equality, and we can reduce discriminatory practices. And it's very difficult to get decision makers to understand the importance of this issue if they themselves have deficiencies when it comes to understanding this topic also. So even in relation to the use of the reusable products that bring so many economic and health benefits, we can scatter them in many places that if people do not understand the benefits and the ways of the use of the types, everything, we're not achieving anything. So education is the key. Yeah, that's to summarize a little bit.
Thank you so much, Laura, for your summary and your parting shots are amazingly spoken. And over to you, Aseel, as we come to the conclusion of our session.
Yes, thank you so much. As Laura said, there is a lot of questions, a lot of things happening in the chat, a lot of the really, really, really nice comments from everyone. It's really informative, and I really like such sessions because we get to learn more from each other. I have just one comment right now. As we are speaking, a ceasefire deal was just announced in Gaza. And it just, for me, for girls and young women and their health in that place who has been torn for more than 1 year with the genocidal intent of Israel, and also in Sudan and also in Congo. And I hope that we have ceasefires everywhere and these conflicts and these wars come to stop. But as they stop, now the real challenge begins, because now the attention goes, the donations goes. There is no one really checks on the people after what happens. And how it relates to our menstrual health, I would just say that, where are the decision makers? Where are you from our conversations? Where are you from our initiatives? We are feeling isolated, and we are feeling alone in this fight. The menstrual health, girls' health, women health. We are more than 50% of the population. Where are we from your policies? Where are we from your funding? Where are we from your plans? Um, Please, it's not us asking you, it's a demand. We need menstrual health in public policies. We need you to provide assistance. We need you to collaborate with youth and international organizations and local organizations more. We need you to establish mechanisms to end this, because how are you going to sustainably develop a nation and end all of these other issues when we are isolating more than half of your population, because they cannot really contribute to public life because of their health issues? So my call to action is for all decision makers. It's time for you to stop pretending, to stop tokenizing us, to take us seriously and to take our demands seriously, because what we are talking about, we are the future and we are the present also. So it is time to end all of this. It is time to go out from that only individuals and their fight, because they have been doing amazing. They have been carrying these issues for a long time. It's now time for our decision makers to take a serious step to collaborate more with us. These are my concluding remarks. And
Wow.
I'm so happy that we have finally reached a ceasefire in my country. I honestly struggled to prepare for this session, because I was just I kept just scrolling and looking for more information about it, because it was supposed to be these 2 days. So I'm so happy, and I hope every other country who is also suffering from current wars also have this moment. Thank you so much.
Wow, thank you so much, Aseel. Really amazing. I think, guys, we can give her a reaction of her heart for that. Really, I am also really happy for you and your country about that. But also, once again, thank you everyone for making it to this particular session. I know that we are time bad, and I just want to make conclusive remarks. Really, I think you've had the amazing conversation that we have had. On investing in menstrual health. I know that there are a number of questions and comments in that chat. I saw one from Caroline from Uganda, who is currently in Austria. Thank you so much for your comment. And then Ben, who had asked to text in the chat. I see your comment about decentralization of the pad booth in West Nile. We'll definitely have a bilateral conversation about that. And feel free, everyone, to check our pages. I want to give a shout out to our my group members, Aseel and Laura, but also to our panelist, Ashlee, in her absence. And really, as we wrap up, really, in general, I want to wrap this conversation in 3 parts. One, what we have agreed on in this conversation today is that period poverty costs a lot. We have listened to the cost of not investing in period poverty, and trust me, the cost is very high and it's relative. The second thing for us to note, at least if you forget everything else, if you forget our countries or our names, please remember that period poverty is a policy and budget issue. So all those policy makers, all those people that make budgets, in Africa we have a lot of parliaments, representatives of the Senate and whatnot, and particularly in Uganda, we have members of parliament. They need to be put to book and to account. What are they doing in those houses? You know, especially in Uganda, we have also women representatives in parliament. So how accountable are they to us that period poverty is going to be ended? And very lastly is that it's important really to spread the information, the awareness, to merge forces and partnership like we have done in today's session in order to end period poverty, but also to enhance menstrual hygiene. Through all this, I know we could have this conversation for hours and hours, but unfortunately we can't have it. Keep writing about it. Follow NGO CSW for the other sessions yet to come. I want to particularly on behalf of Group 1 appreciate Rachel and Amanda. Guys, let's give them a heart as well. Rachel and Amanda, thank you so much for guiding us through all this. We look forward to also attending the other sessions to come, but we really appreciate you for bringing us this far. We learned teamwork and so much more on at the Global Youth Fellowship. Really, we can't wait for what lies ahead. And of course, very lastly, my fellow or our fellow cohort mates of the Global Youth Fellowship, I want to give a shout out to you as well. In less than a minute, I took note of the ones that are there. I saw Prince, Priya Diri, I saw Hawa, I saw Karen, I saw Sena, and of course Laura and Aseel. Thank you so much. Ladies and gentlemen, and everyone on the space, I appreciate you for giving us your time. I would like to end here, and over to you, Amanda.
Thank you so much, guys. I think it was a very amazing session. So very grateful for all of you and this incredible presentation that you pulled out. Just a friendly reminder before we wrap up this session, we have other coming sessions too, where we'll be talking about human rights, well-being resistance, Beijing Plus 30, and many more. You have the registration link on the chat, so please feel free to share them and join us for those sessions. Thank you so much for today, and see you on the next Wednesday that we have a session.